So we told bar, right?
Yes.
Okay. So if you see, just randomly we are going for the cross section. This is the 4-5 area. The length is, the ridge width is only very thin. Okay, 3 mm, 3.3 mm, very thin ridge. Maybe because of long-term denture or long-term denturousness. So this is 6 area, right? The key area is the premolars. Okay, the bone width is not good. Though the bone height is good, the bone width is not good. Maybe the patient is wearing dentures. Or the patient extracted those teeth very long. So this is ideal for screw retained processes. Single piece multiunit we are going to place. Okay. So what is the plan is? We will be placing 6 implants. The standard plan is placing 6 implants, one in pterygoid, one in pterygoid, and another one in the 1-1-2-1 region, and one is in the 4 or 5 region, tilting mesially, tilted implant in the 4-5 region. Okay. First we will plan the 1-1-2-1 region. So this midline relucens is the incisive canal, just adjacent to the canal. Surgically you can expose the canal and you can take it as a guide. The nasal floor is very thick, you can see 1800, 1900. So we can use the nasal floor. The length is, see, till the apex, even beyond the apex the bone is lost. Okay. So the more you tilt the implant towards the palatal bone, the more length will get. Okay. I have tilted the implant more palatally. The length is around 14. If I am doing straight, it is coming around 12, 13. So anything is fine, provided you engage in nasal cortex. So if you are using bioline single piece multiunit, 4.2 into 13 will be doing fine. Okay. And 2-1 implant will be fine. The thing is, in 2-1, this is where the trouble comes. It's not exactly in the 2-1, it is in the 2-1-2-2 area. There is severe bone loss. That is one trouble. Okay. We cannot use a compressive. So what we can do is, we can check the canine area. Okay, this is the canine area. Okay. Canine area you can place one implant. Okay. So canine area, instead of going straight into the canine, I am just tilting slightly mesially. Okay. And we will add one implant in the right side, 1-4. Okay, 1-4 or 1-5. If you see, the bone is very thin, right? But there is one small trick here, it's called palatal approach. If you slightly tilt mesially, okay, if you tilt the implant slightly mesially, you will get engagement from the mesomaxillary buttress. Okay, so start the drilling from palatal and come towards the buccal side. Come towards the buccal side means you should not perfect buccal side. If you have seen the X-ray case, we perfected buccal side, then we rechange the direction. So from palatal aspect to buccal, palatal to buccal, this is one angulation, and another angulation is from distal to mesial. So both angulation we are tilting. In this plane we are tilting mesially. In this plane we are tilting from palatal to buccal. So almost 4.1 into 18 mm titanium implant we can place. Okay, we'll get nice stability. So this is the palatal approach technique. Okay. Then right side we will see whether there is any good bone in the molar area. If there is any good bone in the molar area, we can avoid pterygoid. Okay. So this is molar area. Very short implant, right? Going to it. So actually this one tilted implant and one axial implant is enough for one side. Whatever we are giving is additional and to avoid cantilever maybe. We are checking the pterygoid now. The pterygoid does not come in the CBCT, but the bone looks good, right? There is good